So the TAKTIC study is a Phase I open-label trial exploring the utility of the AKT inhibitor Ipatasertib in hormone receptor-positive patients with metastatic breast cancer. The TAKTIC study, to a large extent, is based on some preliminary data that we and others have generated in the laboratory, which have shown that a subset of patients that develop resistance to hormonal therapy and targeted CDK4/6 inhibitor therapy do so through AKT pathway activation. So the concept was to utilize an AKT inhibitor in patients that have developed hormone and CDK resistance, with the idea that we may be able to resensitize or overcome resistance in those situations. So the TAKTIC study is a 3-arm study. There are 2 doublet arms. Those 2 arms have the AKT inhibitor with an anti-estrogen, either an aromatase inhibitor or fulvestrant. And then there's a triplet arm, which is a combination of fulvestrant, the AKT inhibitor Ipatasertib, and the CDK4/6 inhibitor palbociclib. And again, this was a Phase I study, so it was primarily looking at safety and tolerability, but we did also get some preliminary insight into potential clinical utility based on overall response rate and clinical benefit rate. In terms of safety, the drugs were generally well tolerated, and there were no real unanticipated toxicities. We've had experience with drugs in these pathways, right? Hormone therapy, CDK inhibitors, and PI3K AKT pathway inhibitors. We see reduction in the blood counts. We see occasional GI toxicity and rash. We see occasional increase in the blood sugar, as we would expect from the AKT pathway inhibitor. And in terms of effectiveness, again, it's a small study with 3 different arms, so we're not generally powered to look deeply at clinical response, but we do see subsets of patients that have demonstrated clear, partial or near complete responses. And one of the things we're going to be looking at in the coming months are whether we can identify any biomarkers in terms of identifying which patients are most likely to get those deeper response versus patients that may be less likely to respond based on genomic or molecular features of the tumor.